How does the brain cause hoarding disorder and OCD? Have you ever wondered how the brain contributes to hoarding disorder, especially in the context of obsessive-compulsive disorder? Hoarding disorder is a complex condition that involves significant brain function abnormalities. These abnormalities mainly occur in areas responsible for decision-making, emotional regulation, and how we attach significance to our possessions. One key area affected is the anterior cingulate cortex, often referred to as the ACC. This part of the brain plays a vital role in executive functions, which include decision-making and emotional regulation. Research shows that individuals with hoarding disorder exhibit a unique pattern of activity in the ACC. When they are faced with the decision of what to do with their possessions, the ACC becomes overly active. This heightened activity reflects a strong emotional attachment and anxiety about discarding items. On the flip side, when they consider items that do not hold personal significance, the ACC shows reduced activity. This suggests that they struggle with emotional engagement when it comes to things that are not their own. Another important brain region involved is the insula. The insula helps process emotions and our awareness of internal bodily states. In people with hoarding disorder, the insula's activity is heightened when they evaluate their own possessions, indicating a strong emotional connection. However, when they look at items belonging to others, the insula's activity decreases. This difference contributes to the intense feelings associated with their own belongings and the difficulty they have in managing those feelings. The frontal cortex, which includes areas responsible for planning and categorization, also shows altered activity in hoarding disorder. This dysfunction can impair the ability to organize and make decisions about possessions, leading to the clutter and avoidance behaviors that are characteristic of hoarding. Cognitive and emotional factors linked to these brain dysfunctions include poor attention and memory recall related to possessions, as well as difficulties in categorization and decision-making. Maladaptive beliefs, such as perfectionism and fear of making wrong decisions, can further exacerbate these issues. These cognitive and emotional deficits are thought to arise from the neural dysfunction in the ACC, insula, and frontal regions, reinforcing hoarding behaviors and making it hard for individuals to change. Interestingly, while hoarding disorder was once considered a subtype of obsessive-compulsive disorder, neuroimaging studies have shown distinct patterns of brain activity in hoarding disorder compared to OCD without hoarding. The unique activity patterns in the ACC and insula are not seen in typical OCD, supporting the idea that hoarding disorder is a separate condition within the OCD spectrum. In summary, hoarding disorder is influenced by abnormal brain activity in key areas such as the anterior cingulate cortex and insula. These brain dysfunctions lead to difficulties in emotional regulation and decision-making about possessions. Understanding these mechanisms helps explain why hoarding behaviors can be so persistent and resistant to change. If you or someone you know is struggling with hoarding disorder, it is essential to consult a healthcare professional for guidance and support.